Hello, Healing Spot community. Sorry I'm a little bit late. I ran over a little bit with my last patient. So I'm a little later than I said I was going to be. I apologize about that. But today I'm talking about what I look for and what I evaluate during a postpartum screen as a women's health physical therapist. So I want to touch base on that. So if you have recently had a baby, or if it's even been years since you had your baby, you may be experiencing some issues postpartum that you weren't experiencing before you had your baby. So I'm just going to go over the types of things that I look at, and I want to start by saying, for one, my name, I'm Justine Calderwood. I'm a physical therapist here at the Healing Spot Physical Therapy in Woodland Park, Colorado. And I want to say that I'm going to show you or talk to you about what I do during an assessment and what I treat postpartum, but I don't do all of these things that I'm going to talk about day one. If so, my patient's head would be spinning, and I mean, there would be so much to do. So I'm going to talk about the things that I look at and why I look at them. But again, I don't do this all day one, okay? So, first off, so I'm just going to start by saying a lot of this I've learned through the Institute of Birth Healing with Lynn Schulte out of the Boulder area, Boulder, Colorado. I finished her certification program. I'm working on completing the rest of the requirements for that, which just is some case studies to write up on people that I'm seeing currently. So a lot of this is based on Lynn Schulte's work, okay? So I have baby here and I have my pelvis so that I can talk a little bit about this. It'd be great if I had an actual patient to talk about this a little bit more. And then the other thing that I want to say is everything that I do and treat for my patients, I've experienced myself, okay? Meaning, as a practitioner, every single technique that I do on patients, I have received as a patient in a lab portion in class, okay? So I don't do techniques that I have never experienced myself. And I think that's really important to tell you, because some of what I'm going to talk about may seem like, whoa, you know, you may not know that physical therapists do the type of work that I'm going to talk about, okay? So this may be the first time that you've heard this, but we're movement specialists. We really look at, you know, how the body is moving, muscular systems, and the bony structure, and all of that stuff. So let's get started. So one of the first things that I look at when someone comes in, we go over health history and talk about, you know, tell me about your birthing experience and things like that, and gathering a lot of information when I sit down and talk to people, and with the paperwork that they fill out ahead of time. But when they actually come in and we get started, I'm going to look at posture, okay? So I'm just starting to gather information on how they're holding themselves, where strain patterns might be, what may have developed in the body. So I start with that, and I do some listening. So I may put my hands on shoulders. A lot of times I'll put a hand front and back of the hip into the lower abdomen and the low back, and I'm really listening and feeling for what is the body naturally wanting to do, okay? I'm going to talk a little bit more about open birthing position here in a little bit, but what I'm feeling for with a new mom or even an experienced mom, I mean, I'm talking, if you've had your babies 50 years ago, it does not matter. This stuff may not heal on its own. So what I'm looking for is, I'm feeling for, is mom's body still in that birthing position? Is her sacrum still opening, you know, actually opening up this way? Because when baby's born vaginally, these bones here, the sits bones, have to open up to allow baby to come on through, and the tailbone needs to move out of the way, the sacrum. And so I'll just start to feel, is the sacrum still doing this motion? I feel for the ischiums here. Are they splayed outward? Okay, that's indication that the body is still perceiving that it's birthing, and we call that the open birthing position. So there's a lot of women walking around, their body, in all intents and purposes, feels like it's still birthing, but yet they're not. They've already had their baby, okay, and it may have been years ago. So I listen. The other thing that I look at is I feel and I look for what the organs are doing, okay? So as you are pregnant and baby gets bigger, what happens is the liver on the right side and the stomach on the left side, they start to ascend up to accommodate for growing belly. And so what I do postpartum is I feel and I help those organs to come back down, because If the organs aren't happy, the body's not happy, okay? So I look at liver and stomach, I get them to rebalance. I'm looking at the lungs, because again, the lungs have to go up as well, so I'm helping mom to get those lungs back down. It's very, very gentle. I just use my hands. I'm feeling for kidneys. The adrenals, you can get into this adrenal fatigue, and where the kidneys are also working overtime. And what that does is it causes the body to feel like it's, again, just in fight or flight, okay? So I'm feeling for all of those organs and helping to rebalance that and helping them to feel better again. The bladder is another great thing that I look at. If the bladder's not happy, you may be experiencing some leakage, some accidents, things like that. And then I also look at and feel the uterus and the cervix and what's going on there, okay? I look at bony alignment and bony or sacral mobility, okay? So I already touched a little bit on this, but as baby is born vaginally, he or she has to go down through the pelvic cavity, and these ischium open up and they splay open, and the sacrum has to move out of the way, okay, to make this canal bigger. So even if you had a C-section, if you tried to have a vaginal birth and then, things shifted and you had to end up having a C-section, your body may have started to initiate some of this. Even though baby didn't come out vaginally, your body still may be experiencing some of this open birthing position, okay? So I check mobility and see where things are at. I do a lot of spring testing side to side, and I'm checking to see is this bony structure moving correctly, and if not, then I gently use my hands to bring balance back, okay? So this open birthing position is a splayed ischiums here. I had a lady recently who came in postpartum who said that she labored on her back and she was in happy baby. So if you're a yogi at all, so basically happy baby, both knees up to her chest, and she was like that, delivered. And when I checked her, she was splayed open, okay? And the way that I helped her to get that back was I put her in happy baby, had her hold on. Actually, she put her legs right here, and I just helped to bring those ischiums back together, okay? So when this is happening, that open birthing position, the pelvic floor muscles are being overstretched. Hi, Christine, thanks for joining me. So they're being overstretched, and so the pelvic floor muscles can't engage like they should be able to, and then you can have issues like prolapse issues or leakage, okay? So bringing that bony structure back together where it needs to be and getting the mobility restored is super important. Another thing that I look at with new moms or even older moms is this diastasis recti. So basically this zipper up through the linea albia, the connective tissue that keeps the abdominals together. With growing baby, that will can start to separate, and then so I look for that. Is that still open? Is it able to approximate? If not, there are techniques that I can do to release the lower abdominal fascia to help approximate that. Last week I had a gal that I had 2 finger widths right at her belly button, and I did the techniques of soft tissue release, and we got it down to 1 finger width in 1 session. And before she left, she was like, wow, I had no idea that you could do that quickly. So absolutely. And then I look at the inner core. So the diaphragm makes up the top of the inner core. So when we look at the inner core, it's really the stabilizers of your trunk. And so we look at the diaphragm and how it can engage. The bottom of the inner core is the pelvic floor muscles. The front part is the transverse abdominis muscles. So they go across the body like this, attach onto the back. And then from the back are the little muscles called multifidi muscles, okay? So when we look at inner core and those stabilizers, we see, are they able to engage, okay? And there's ways that I can help mom decide if they're engaging correctly, and if not, I'm gonna help her work on activating the inner core. Because if the inner core is weak, the outer core will start to take over, but they do a lousy job at stabilizing. Those are the rectus abdominis, so those are the movers. They allow you to come forward and do, like your crunches and lean forward. And also the obliques, the rotators, okay? So again, if the outer core is taking over and trying to help out the inner core, does a lousy job, and it can actually put a lot of pressure into the pelvis, and it can lead to pelvic organ prolapse. So I don't have my other model is over there, but the organs that can actually prolapse and they can even come outside of the body include the bladder, the uterus, and the rectum. Okay, so any of those structures in the pelvic cavity, they can start to prolapse, and when that happens, it can lead to a heaviness or pressure, or even feeling like things are going to simply fall out. But it can also lead to things like leaking, okay, with coughing, sneezing, running, jumping, that kind of stuff. And so what I do is also check for prolapse, and I can feel those organs. And so some of what I do, a lot of what I do is done externally, meaning my hands are on the outside of mom's body, okay? But I do some internal assessment, and it's not, I feel like, it's not any more invasive than a well woman exam. In fact, I don't use stirrups or any kind of instruments. I just use it's just a digital exam, and then what I'm looking for, I'm checking for integrity of the pelvic floor. I'm checking to see where is the bladder, if it's pulled off midline because of how mom, had baby in her tummy. If it's pulled off midline, if the bladder's not happy, it'll make the pelvic floor not happy. So I'm looking for that. I'm looking for relationship of the cervix and the uterus, what's going on internally, and helping those organs get back to midline where they need to be. May release some soft tissue restrictions around those organs, and it starts to make the pelvic floor a lot happier. I also like to check prolapse in standing, because we can check it lying down, but you probably don't have issues with coughing, sneezing, leaking, and that kind of stuff when you're lying down, right? It's usually when you're upright. So we check it with you standing, actually. So I won't go into a lot of that, but just know that's more of an internal assessment. So we go through the vaginal opening and we're checking for those structures, okay? Again, nothing that I haven't experienced for myself, okay? It's not scary. And then I also look at scars. So if you've had a C-section, I look at the mobility of the C-section scar. So let's say, it's down here, lower abdomen. I'm checking the integrity of that soft tissue mobility, because you may not think about it, or think of it like this way, but if you have a scar in the front and it's starting to clamp down, it can lead to low back issues. It can lead to sacroiliac pain, sciatica, that kind of stuff. But it can also lead to pain in the pelvic area, so pain with sex. And I also look at any kind of scarring that might have happened from an episiotomy or tearing during childbirth. Those can really cause a lot of trigger points, a lot of pain, and so just very gently helping mom release those so that she can go back to being, partner, wife, but also mom and woman. So I'm really passionate about doing this type of work. I gave you, just in a nutshell, again, I don't do this all day one. That would be super overwhelming, but I split it out. Once I find something, I'm like, okay, this is what we need to work on today. When that starts clearing up, I might move on to the next thing. I might check 2 or 3 things in one session, but again, it's more of a progressive assessment, and help mom out as needed, depending on what kind of symptoms she's having. If you have access to the internet, which I'm sure you do, why don't you go to my website? It's just healingspotpt.com. I have this postpartum checklist. I just got up on my website a couple weeks ago. It's a really great guide. It's free. All you have to do is provide a few contact information, and you can get this postpartum checklist. So check that out, and I go in a little bit more detail on the things that I just barely covered today. The other thing is I invite you to join the Institute for Birth Healing Facebook page. Lynn Schulte, she's been a PT for 30 years. This is who I'm learning a lot of this from. She does a lot of education on in her Facebook community. It's called the Institute for Birth Healing, and you can request to be a member of that. And then the other thing is that I have a class coming up next week. I have a Recover Mama class coming up on Wednesday the 23rd from 5:30 to 7. I'm going to be teaching a small group class. I have room enough for 6 people. So that is available on the classes page on my website. So check that out. It's just going to help you to bring awareness to the pelvic area. We'll go over into this a little bit more detail on what you can do at home to help yourself and to help recover. So if you have any questions, please leave them below. I will get back to you. I'm happy to share my information or my knowledge. And if you are interested in getting some one-on-one help, start with a discovery session. It's available on my website on the homepage, and you can get started that way. So thanks for watching. I appreciate you being here. Bye-bye.